Okay, this is a short video on fetal hypertension. It's one of three I'm going to make, one on fetal hypertension, one on pregnancy hypertension, and one on adult hypertension. They all have a similar pathophysiology, though different causes. This work was done in Shanghai Jiaotong University in 2019. I'm going to present you some of the preliminary results, but there's a great deal more work to do on this particular topic. This is where I work. This is the teaching center at the Peace Hospital in Shanghai Jiaotong, and this is in the suburb of Shijiahui, very close to the Shijiahui underground station. I work in the Department of Pathology, which is over here. This is the main ward block with the labor ward on about level 4, and this is the outpatient block inside. What we're going to discuss is fetal hypertension. Now that immediately seems like a contradiction, because how do you measure blood pressure in a baby? You can't put a cuff on, you can't put a catheter into any artery or anything like that, but you can look at the histology of different parts of the umbilical cord and placenta, and that's what we've been doing in Shanghai. Couldn't do it without my colleagues, Wang Yangqiu, Wang Yuan, and it's been done in the department of Professor Zhang Huijuan, and all is supervised by Professor Huang Hefeng, who is the leader of our hospital. Now, histology of the umbilical cord is not going to be that familiar to many of you, and so what I've done is produced a stylized diagram here of a fetus. This is the inside of the baby. This is the baby's tummy button, umbilicus, and this is the anterior abdominal wall here. This is the umbilical cord outside running into the placenta here. And what we're going to do is look at two tissue blocks, one taken from here on the outside of the baby, and then another one on the inside of the baby. These were two stillbirths at 18 and 28 weeks, which came through our department in 2019. What you see when you take the block from here in the outside of the in the umbilical cord is this sort of appearance, and this is a normal umbilical cord. This is a umbilical cord with medial hyperplasia here, this thickening of the layer around the lumen of the umbilical artery, and this shows it in place in 3 separate vessels. When you look on the inside, across the what we call the urachus and the 2 umbilical arteries within the baby's abdomen, then this is what you see. This is the embryological remnant called the urachus, which becomes the median umbilical ligament, and then here's the umbilical artery on the left, and here's the umbilical artery on the right. And what you can notice immediately around the vessels is this huge brown staining, and these are all injured and abnormal vasomotor nerves. Those are the nerves that run with these vessels in the normal situation, but which have been seriously injured in these babies. Now, the mechanism of the injury, we think, is if we look at on the left-hand side, this is the normal umbilical artery and nerve with its nerves here, and here in cross-section. And you can see here that there's a normal-sized lumen, we call it the channel through which the blood flows. Whereas when this nerve is injured, it releases a lot of what we call cytokines, which are proteins which have different effects on both nerves and blood vessels as a consequence. And one of the two key effects are these: that the injured nerve regenerates in this to produce many abnormal injured nerves like this, as we've just seen in the previous slide, and the vessel wall becomes thickened. There's hyperplasia of the vessel wall or tunica media, and this is a consequence. This is only happens when you've lost the nerve supply, but we think this is highly significant in all forms of hypertension. Now, when you look around these babies, what you see, these are the different organs that we've looked at. One with this traditional stain of hematoxylin and niacin, and then this stain is, the brown is for looking at nerves. And you can see here in all the organs around these blood vessels, this is a big blood vessel here. You can see injured nerves here. Here's another blood vessel in cross section. Again, many injured nerves. Again, this is in the lung, many injured nerves. And again, in the spleen, injured nerves. When you look in other places, you see exactly the same. If we concentrate on this column here, because this is the highest power times 400, you see injured nerves all the way around here, all these different shapes of and directions of nerve. And then in this one, what I want to draw your attention to in the pancreas is the loss of nerves in the large plexus behind it, the celiac plexus. And we'll come back to that in a moment because we think it may be significant in terms of some adult diseases. This is a times 200 or times 400 view of the kidney and the pancreas. Here's a blood vessel in the kidney surrounded by injured nerves like these here, and again you can see loss of nerves on this side. And then this is pancreas with the celiac plexus, which is one of the big autonomic plexi behind it, and you can see this vast loss of nerves in these nerve bundles just behind the pancreas. And we think this may be significant in terms of subsequent adult hypertension and subsequent type 1 diabetes. And these are two of the conditions that David Barker discovered were that much more frequent in small babies in his remarkable studies in the 1990s that became known as the fetal origins of adult disease hypothesis. He postulated a programming event in the uterus which gives rise to this. We say there may be that just a denervatory event that takes place and may account for these changes. It's the same in adult hypertension. We've looked here at the same organs, kidney, spleen, pancreas, and adrenal. And if I just draw your attention to column 2, column 1 just shows you narrow blood vessels. This is column 2, and you can see all these injured nerves here in the kidney, here in the spleen. See loss of nerves in this pancreatic nerve bundle, and then again in the adrenal with adrenal cortical hyperplasia, one important source of hypertension, all these injured nerves. In the uterus here, you see exactly the same in preeclampsia, injured nerves in the lowest part of the uterus, but you see these narrowed blood vessels throughout the organ, and often with this purinergic stretch receptor, which may be the trigger for preeclampsia in some circumstances. So in summary, what we've shown you is fetal hypertension is a histological diagnosis. We've shown you that there's significant injuries to both renal and pancreatic nerves that may account for some forms of the fetal origins of adult disease hypothesis. And we've seen similar injuries in adult hypertension and pregnancy hypertension, which we're going to discuss in a short while. This is the syndrome of fetal hypertension. We think it's caused by maternal stress, but we haven't proven it. We think that noradrenaline and adrenaline just cross from the mother to the baby, and we think it's that's putting up the baby's blood pressure and causing these injuries to the adjacent nerves, and that it may be important in terms of later adult disease. Thank you very much for listening. That's all I want to say on fetal hypertension. The next video will be on pregnancy hypertension, where again we'll have something to say which is a little bit different, a little bit new.